a passionate researcher, Dr. Djigoué, and his journey at Université Laval. Dr. Guy Bertrand Djigoué, a name that resonates today in the world of medical research. A brilliant scientist chose Quebec and Université Laval to pursue his dream, to fight cancer. It is within the chemistry department of this renowned institution that he completed his doctoral studies, under the supervision of a recognized expert in the field, Professor Donald Poirier. Professor Poirier's laboratory is a true breeding ground for innovation, focused on the design and synthesis of new therapeutic molecules. Dr. Djigoué finds a stimulating environment there, conducive to learning and scientific exploration. Cancer, a word heavy with meaning that evokes fear and uncertainty. This complex disease represents one of the greatest public health challenges. Millions are diagnosed yearly, facing heavy treatments. Medical research is evolving, exploring new ways to treat cancer. Enzyme inhibitors are promising, blocking enzymes involved in tumor growth. Hormone-dependent cancers are sensitive to this approach. Dr. Djigoué designs inhibitors of 17-beta HSDs, paving new therapeutic strategies. Steroid hormones, essential chemical messengers, are produced from cholesterol via complex enzymatic reactions. Key players in this process are the 17-beta hydroxysteroid dehydrogenases, or 17-beta HSDs. These enzymes catalyze the transformation of inactive steroids into active hormones. Their activity ensures a precise hormonal balance essential for proper body function. Three isoforms, 17-beta HSD1, 3, and 5, are of particular interest in cancer research. Each enzyme plays a role in producing hormones involved in tumor growth. Selective inhibitors, a new weapon against cancer. Researchers are developing selective inhibitors of 17-beta HSDs to combat cancer. The goal is to block the target enzyme without affecting other essential processes. Inhibitors like CC156 show promise in inhibiting breast cancer cell growth, but challenges like low bioavailability and high toxicity remain. Dr. Djigoué is creating more potent, selective, and better tolerated inhibitors. His approach uses non-steroidal mimetics to improve pharmacological properties. This has led to new families of promising inhibitors for breast and prostate cancer. Promising discoveries. Dr. Djigoué paves the way for new treatments. The research of Dr. Djigoué has led to promising discoveries in the field of 17-beta HSD inhibitors. His work has made it possible to identify new families of molecules capable of selectively blocking the activity of these enzymes, thus opening the way to new therapeutic avenues for the treatment of breast and prostate cancer. One of his most striking discoveries concerns the synthesis of non-steroidal mimetics of CC156, a known inhibitor of 17-beta HSD1. By modifying the structure of this reference molecule, Dr. Djigoué and his team have succeeded in improving its pharmacological profile, increasing its inhibitory potency and selectivity while reducing its toxicity. These new inhibitors, tested in vitro on breast cancer cells, have shown a remarkable ability to block cell proliferation and induce tumor cell death. The hope for a future without cancer, the potential impact of Dr. Djigoué's research. Dr. Djigoué's revolutionary work on selective inhibitors of 17-beta HSDs opens up promising breast and prostate cancer. His discoveries, the result of rigorous and innovative research, could one day translate into new therapies that are more targeted, more effective, and better tolerated by patients. The impact of his research extends well beyond the simple development of new drugs. Indeed, his work contributes to a better understanding of the molecular mechanisms that underlie tumor growth and paves the way for new avenues of research to Dr. Djigoué, through his commitment, his talent, and his determination, embodies the hope for a future without cancer.